We're joined now by Dr. Larry Greenbaum with the American Society of Pediatric Nephrology. Good morning.
Good morning.
How are you?
I'm doing well, thanks.
Well, thank you so much for joining us. Talk to me a little bit about what ASPN is doing to improve child nephrology care.
Well, ASPN is really dedicated to improving child nephrology care. We do it in a lot of ways. One is by simply educating our members, providing opportunities for them to learn more about the care of children with kidney disease. We also do a lot of advocacy work looking to improve the care of children with kidney disease. We work with people in Washington. There are lots of initiatives that we're undertaking, including trying to get better benefits for children who had kidney transplants so they don't lose their insurance after 3 years. We're also working on initiatives to guarantee that people who donate kidneys, for example, parents who donate kidneys to their children, aren't discriminated against in terms of health insurance and life insurance. So we're constantly looking at ways to improve the care of children with kidney disease. We also are engaged with advocacy groups that are run by patients and parents that are looking to improve the care of those children, and we're providing education for them, and we're working with them again in Washington to develop programs that will enable those children to get better care.
So you've mentioned Washington. Why is it so important to educate and to advocate when it comes to nephrology care?
Well, there's, as you know, the healthcare is very complicated, and there's lots of issues in providing health care to children. Many people don't realize that children with kidney disease are covered by Medicare, and a lot of Medicare legislation is passed only thinking about adults, and a lot of Medicare rules are passed only thinking about adults. And so we have a very active role in making sure that when changes are made in Medicare, that the children with kidney disease are also considered, and they're not left behind, and they're getting the benefits that they need in order to receive the care that they all need to be successful.
That's a surprise to me. I had no idea.
Very few people realize that because of kidney failure is covered by Medicare for all Americans, including children, and that's the coverage they receive, but it's also a limitation in if that care is not adequate.
Well, you said 3 years before, and I was going to ask you that question, but that answers it right there. So what's the main focus for the Society in the coming year?
Well, we are always focused on a lot of different areas. One issue that we're always emphasizing is our workforce. There's a relative shortage of pediatric nephrologists. There are places in the country that don't have enough pediatric nephrologists to take care of children. So we are undertaking a lot of initiatives to increase the number of pediatric nephrologists, and also make sure that programs are in place to enable people to have a career in pediatric nephrology. We're also focused on member education. We have initiated new programs such as board review courses, pathology webinars, all sorts of things to educate our members. In addition, as I mentioned, we spend a lot of energy and effort, our members do, in working for advocating for our patients in Washington, D.C.
Well, Dr. Greenbaum, that's all the time we have. Thank you so much for joining us today.
Thank you.